Ify, and this is Ify Health View, where we talk about everything reproductive and sexual health. In today's video, we are going to talk about miscarriage, causes and symptoms of miscarriage, and how miscarriage can be managed or treated. First of all, what is miscarriage? Miscarriage is the spontaneous loss of a pregnancy before the 20th week. About 10 to 20% of known pregnancies end in miscarriage. But the actual number is likely higher because most miscarriages occur very early in pregnancy, even before you realize that you are pregnant. You've already miscarried it. The term miscarriage may suggest that something went wrong during the process of carrying the pregnancy. But this is rarely true because most miscarriages occur because the fetus isn't developing as expected. Miscarriage is a relatively common experience, but that doesn't make it any easier. Now, let's talk about the factors that can cause miscarriage. What are the causes of miscarriage? There are several factors that can cause miscarriage. Number one is the problem with the gene or chromosome. Like I said before, most miscarriages occur because the fetus isn't developing as expected. About 50% of miscarriages are associated with extra or missing chromosome, but not an inherited problem from the parents. The second one is the maternal health condition. Maternal health condition can also lead to miscarriage. In few cases, the mother's health condition can cause miscarriage. For example, diabetes, infections, hormonal problems, cervix problems, or uterus problems, and most times thyroid diseases. All these contribute to the maternal health conditions that can cause miscarriage. So it is advisable you treat yourself of any of these diseases. If you notice the symptoms of any of these, treat it before getting pregnant so that you will not be exposed to miscarriage. Now, let's look at the risk factors that can expose anyone to miscarriage. There are various factors that can expose anyone to miscarriage. These include, number one, age. A woman older than the age of 35 has a higher risk chances of getting miscarriage than younger women. At age 35, you have about 20% risk of having miscarriage when you're pregnant. At age 40, the risk is about 40% also. And at age 45, the risk is about 80%. The older you get, the higher the chances of getting a miscarriage. Another risk factor that can expose anyone to having a miscarriage is previous miscarriages. Is a risk factor. Women who have had about 2 or 3 miscarriages previously or consecutively are at higher risk of having another miscarriage. So it is advisable you go for checkup, have a proper medical checkup, tell your doctor the experiences you've had before, so that whatever underlying sickness or condition that have caused the previous miscarriage can be treated or can be taken care of before you take in again. Else, the causes of the previous miscarriages will still expose you to having another miscarriage. So, previous miscarriages are a risk factor that can expose anyone to having another miscarriage. So, whatever that has caused the previous miscarriage can as well cause another one if it is not treated. Another risk factor that can expose anyone to miscarriage is uterine or cervical problem. Certain uterine condition or weak cervical tissue might expose anyone to a risk of having a miscarriage. Smoking is another risk factor that can expose anyone to miscarriage. If you are a smoker and you are pregnant, you are at a very high risk of having a miscarriage. Smoking, alcohol, and the use of illicit drugs can expose anyone to having a miscarriage when you're pregnant. So if you're a smoker, or you use drugs, or you take alcohol, and you are pregnant, you will be exposed to the risk of having a miscarriage. This is because women who smoke during pregnancy have a higher risk of having miscarriage than women who do not smoke. Alcohol use and the use of illicit drugs also exposes anyone to having a miscarriage when you're pregnant. The next factor that can expose anyone to having a miscarriage is weight. Weight, either overweight or underweight. We're going to explain that. Being overweight or underweight exposes anyone to the risk of having a miscarriage. When you are underweight, that simply means that you are lacking nutrients. There are certain nutrients your body needs to build up your immune system and to build up your general body system in order to carry the baby. But you are having deficiency of these nutrients, and that is why you are underweight, you are lean. As a result, there will be lower volume of blood, there will be lower volume of nutrients that should be in the body fluid, and the strength or the energy to carry the baby may not be there. Now, let's look at the symptoms of miscarriage. What are those signs or changes in your body system that will make you know that you may be having a miscarriage anytime soon? These are the symptoms of miscarriage. Changes in your body system, evidence that you may be having a miscarriage soon. So let's look at those symptoms. The signs and symptoms of miscarriage may include the following. Number 1, vaginal spotting or bleeding. Vaginal spotting is light vaginal bleeding that occurs outside of your regular period. Spotting typically involves small amounts of blood. You may notice it on your underwear or on a tissue paper after you have used the restroom. Bleeding at any time other than when you are having your regular menstrual period is considered abnormal vaginal bleeding. Therefore, spotting or light vaginal bleeding may be a sign of a serious health problem, which miscarriage is one of them, especially when you're pregnant. Although not often, but note that spotting during pregnancy is common. About 15 to 20% of pregnant women experience light spotting during their first trimester, and that is normal. This bleeding or spotting is often light and may be red, brown, or pink in color. Vaginal spotting typically is not a cause for alarm, but you should let your doctor know, especially when you're pregnant. Let your doctor know that you're having vaginal spotting early when you noticed it. But if you experience heavy bleeding with pelvic pain alongside, then it could be a sign of miscarriage. See your doctor immediately. Don't even wait for it to become a heavy bleeding. Once you experience a light bleeding while you are pregnant, see your doctor. It is normal, but when you don't take care of it early, it could result into heavy bleeding and can go along with pelvic pain. And this is very dangerous. It can lead to miscarriage. Apart from spotting, vaginal spotting or bleeding, other signs and symptoms of miscarriage may include pain in the abdomen or lower back, pain at the lower back or pain in the lower abdomen. And most times, another sign can be fluid passing through the vagina. At this point, if you have not subscribed to this channel, please do well to do that. Hit the subscribe button right now. Turn on your notification bell so that you don't miss out, so that you'll be the number 1 person to get notification when I upload a new video like this.